On my Memo tonight, I am a very worried Kenyan and I will tell you why. Today, the government announced 80 new cases of COVID-19 infections in the country, the highest one-day rate since the start of this pandemic in our beloved Kenya. Yesterday, we passed the 1,000 mark in infections after reporting 66 new infections. The day before, we reported 51 new cases. Yes, these rapidly increasing numbers are attributed to increased testing, something many have been calling for. Now, that notwithstanding, the increasing numbers in different areas of the country has me worried about the spread of COVID-19 in Kenya. I see how the disease has devastated developed countries across the world and pray that we never experience that here. Let it remain something you watch on television and hear on radio, because it is true that we do not have the capacity to manage the ravaging effects of COVID-19 that are being experienced in those countries. Remember back in March, the Ministry of Health had projected that Kenya would have at least 10,000 cases of infection by end of April. Thankfully, by the end of last month, the numbers were much lower than that. However, it is important to note the modelling done to make the projections keep on changing based on the variables being input. In any case, we never got to test enough people by then. Today, the ministry said that there is a likelihood that Kenya will have its coronavirus peak in August and September, and that during that period, we'll be reporting up to 200 positive cases or more in a day. Now, the reason why I'm telling you all this is because it seems as Kenyans, we have lost the urgency, the care, the attention and worry that we initially had when the first case was reported. Kenyans are no longer practicing social distancing. Traffic jams are back with a vengeance. At bus stages, it is business as usual. The water points and soap have been taken away. Sanitizers are no longer available. Face masks are worn for the police and worn on the chin the rest of the time. In short, we have all restored to factory settings. Correct me if I'm wrong, but I believe many of us had started getting used to the daily briefings by the Ministry of Health. In fact, there have been memes and templates of how the daily briefings would be. We seem to have got used to the numbers being announced. The interest in the briefings had waned. There were days when everything would stop once the briefing started. That does not happen as it used to. In short, tulikuwa tumezoea. But the current numbers should jolt us back to the reality that we should be on our guard all the time. This disease is now with us, and according to the World Health Organization, it will be with us around for a very, very long time. And that is why hatupasi kulegeza kamba in our efforts to try and stop the spread of the disease in our own little ways, so that we can have some semblance of normalcy. We would all love to see our children back in school, our jobs and salaries and livelihoods unaffected, but these will be difficult unless we cooperate. We should go back to regular hand washing, maintaining social distancing, using sanitizers, and where possible, stay at home. Life as you knew it is gone, and the sooner we get used to this fact, the better it will be for all of us. We have been told, and I quote, if we treat this disease normally, it will treat us abnormally. And that is my memo.